Hi everyone, this is Dr. Shah here, and I want to talk to you about the differences between the different testing modalities out there. So specifically, there's two different testing modalities. There's going to be a few more coming out soon, but I want to talk to you about the two big ones that are out there right now. One's called PCR, which is polymerase chain reaction. That's a nasal swab test. And then we have a blood test called an antibody test. So let's talk about those two. First, let's talk about the PCR. This is the one that everyone's been talking about for weeks. This is a swab, basically a long Q-tip, that we have to put in the back of your nose, way back into the back of your throat to get an adequate sample. And this is kind of how far back it needs to go. Super uncomfortable, but this was the only way to test for COVID up until a few weeks ago. What this test does is it actually collects some of the virus from where the virus lives. COVID lives in the mucous membranes, means the membranes of the back of your throat and the back of your nose. That's where it lives, that's where it becomes infectious. So this actually collects a sample from there, and then we take this swab and we run it through an analyzer, a polymerase chain reaction analyzer, that then tests for the DNA of the virus. So once we find the DNA of the virus back there, we know that you have the virus, and that's a positive diagnosis for the virus. This does not tell us anything at all about where you are in the course of the disease. It just says, yes, you have it, or no, you don't have it. Also, the problem with this test is, as you can see, it really is sample dependent. So if we don't get enough of a sample, say someone is too uncomfortable, which most people I think would be, to have this jammed in the back of their throat, through their nose. If you're too uncomfortable, you don't get enough of a swab, this will come back negative when you really might be positive. That's called a false negative. So one of the biggest things about all testing is knowing what the accuracy of that test result is. And with medical tests in particular, accuracy depends on two factors. It depends on the false negative and false positive rate. That's called the sensitivity. And then also whether or not it is specific for the thing that you're looking for. That's called the specificity. So in medical testing, we look at sensitivity and specificity. Now, when you're checking for something's DNA, as you probably know, like when DNA tests are done on adults, it's really, really specific. You know very confidently that what you're testing for is what you actually got. It's not like you're testing for one person and someone else's DNA comes up and you get a mismatch. Same thing with viruses. When we're testing for this particular virus, COVID, with this test, we know because we have the DNA code of this virus exactly what it is. So it is very sensitive. However, it is very specific. However, the sensitivity of it is in question depending on sampling error. So if something is not very sensitive, but it's very specific, it still has a pretty low accuracy rate. So the accuracy rate of this is not too great. Compare that to the antibody test. Now this is a blood test, so we're actually drawing blood from you, and what's coming out soon is a finger prick test where you can actually send some blood in by doing a small finger prick like diabetics who test their blood glucose. You send this in and we're testing for antibodies to the virus. And what this actually does is you test for different kinds of antibodies that we have in our system, but also antibodies to different parts of the virus. You can test for 4 or 5 different parts of the virus. So the sensitivity and the specificity of this test is really, really high. Number one, it's really sensitive because you're actually testing for antibodies. And when you get a blood sample, a large blood sample, you're pretty much guaranteed to find those antibodies in that blood sample if your body has mounted an immune reaction to the virus. And it's also very specific because we're testing for antibodies that are very specific to this virus and 4 or 5 different types of antibodies. So this does not have too much of a sampling error because you're getting a tube of blood or a blood spot. And so the sampling error risk is also reduced as well. Now, it's really important to know what the difference is between these two tests. So I just want to say once again, the PCR nasal swab test is testing for actual presence of the virus itself, whereas this test, the antibody test, is testing to see if you've mounted an immune reaction to the virus. So both of those could have different results, right? So say you just got the virus a couple of days ago and your body has not yet had the opportunity to mount an immune reaction to it. It takes about 3 to 4 days for you to do that. You're going to come back negative with this test. So in those cases, this could also be a false negative, right? Because it could take some time for you to develop an immune response. This could also happen in immune compromised individuals people who say have HIV, or people who are on immune suppressive drugs. There are a lot of people out there for autoimmune conditions that take immune suppressive drugs that could decrease the sensitivity of this particular test. Now, the other big difference of these two tests as well is neither one of them can really tell you for sure how long that you've had the virus, because it could take some time for you to mount that immune response. And also with the polymerase chain reaction test, we don't know how long you've had it. It's just telling you if it's there or not. So both of these tests have their pros and cons. The blood test, I think, is where we're going, because number one, you want to know if you've had an immune reaction and what type of immune reaction you have and how far along you are in that immune reaction. Those are three really important pieces of data that I'll talk about in another video. But also, it's a lot easier to get this test done. A blood sample is a lot easier to do than putting a nasal swab in. You can also do mail at home kits to get blood samples, and you can mail back in a sample of your finger stick, like I said. And they're also developing tests you can potentially get immediate results at home as well. So all those things are coming, and like I said before in a previous video, the more testing we have, the better. The more you know about what your status is in this virus, and whether you're positive, negative, or had it before and now immune, that's going to be extremely beneficial for you to know, so you know what your next step is in the course of this pandemic. Thanks for joining me.